Hi, everyone.
Hi.
Yeah, busy schedule, Chiru. Thank you very much for giving us a chance for meet you and discuss about this matter. At the same time, I met you a couple of times in Winnipeg. But during that time, I saw that you are dancing with your wife. You are a good dancer. At the same time, I want to inform you, Chiru, that we are going to tape this your presentation, and we are going to upload it to the YouTube in future. So
Sounds good.
other than that, I saw in Facebook you are doing a lot of voluntary work in the US. So at the same time, I will ask our program coordinator, Charlotte, to introduce you to our members. Charlotte, please go ahead.
Good afternoon. Today I will be Today I will be introducing the doctor who is conducting our 55+ group. Dr.Iru Fernando, General Psychiatrist and Addiction Psychiatrist. He completed his residency at Harvard University, South Shore, Massachusetts, USA. He then completed a fellowship in drug addiction at Boston University in MA. Currently, he is working as Psychiatric Wellness Center of Addiction Service, California, USA. He is a frequent invited speaker on TV and podcast and has his own YouTube channel where he talks about drug addiction and therapy. He is the son of Pushpini and Dilanta Fernando. Iru was born in Sri Lanka and lived in Winnipeg for 10 years. He will conduct the presentation in English during the questioning time. You can ask questions in Sinhala as well. Thanks.
Thank you. Okay, thanks so much. So should I start?
Thank you.
Okay. All right. Yes. So thank you everyone for joining today. I'm gonna share my screen. And oh yeah, by the way, Probo has she is also in this call. That is Roshan's wife, and so she will be. If there's any questions, because again, I can't speak Sinhala, I can speak English. If you have any questions, feel free to ask in the presentation, and Probo can help translate in Sinhala any questions you have. And so I've prepared a presentation, which I'll start right now, and then afterwards we can talk about, if you have any questions, we can do that as well. Okay.
It's okay. I got the email also.
Very good. Yeah, so the Sri Lankan community in Winnipeg has been so important for me and my family. And then so about 10 years after living in Winnipeg is when I went and started doing my medical school. And I try to come back as often as I can. Obviously with COVID, I'm unable to do that now because of a lot of the issues that are going in the States with our COVID issue. So personally, I have seen a lot of these issues happening with a lot of my patients, and also with a lot of my friends that are here in the United States as well, and I'm sure around the world. So what I'm going to start off with is talk just very generally about the mental health disorders that there are. I'll try to go past that a little more quickly so we can spend more time on the COVID aspect. After that, I'll talk about how COVID affects mental health, both directly from the virus and also indirectly from things like the isolation and loneliness that we have. Lastly, I'll talk about how we can combat it all together so that we can be a healthier, not only individual, but society as well. So The next, if you can go to the next slide, you'll see that I have a mental health survey among South Asians. I don't know if everyone got the link, but my wife, who is also has medicine, was really interested in this when she found out about this opportunity and did the survey. And if you haven't done it, I would really appreciate it if you can do it afterwards so we can get your opinions and your views on mental health. But if you can see that, and we've had about 50 responses so far, and again, just among South Asians, the question that I was most interested in is, has mental health ever been discussed in your household growing up? And you can see that overwhelming majority of people, about 70% of people said that no, they were not. And then another question that I put in there, how comfortable are you taking medications to manage your mental health? That is essentially what my job is. And you can see that the data or the responses are very skewed. So basically very much in terms of a little bit, the fact that we haven't really heard too much about mental health in our society and maybe in our culture as well. So I'm going to spend a little bit of time talking just in general about it. It's much more common than what a lot of people realize. In fact, they say about 1 in 5 people in the US have experienced a mental health issue in a year, and about 1 in 25 have a really serious one. And they say that about 1 in 6, which again is quite a few people, have been reported to be taking psychiatric medications. So the thing that obviously the biggest risk that can happen from having untreated mental health issues is suicide. And unfortunately, at least in the United States, I believe in Canada too, that is rising very dramatically. It's risen about 24% since 2000 in the United States. And it's becoming worse and worse as well. If we go to the next slide, specifically about Canada, you'll see that about 11 people die of suicide every day, and about roughly 4,000 people in Canada die from suicide. From the ages of 45 to 59, it's about 1/3 of the deaths, which is again a huge amount, is because of suicide. And completed suicide is more common with men, whereas women tend to attempt suicide more often than men. So what are the different disorders that can cause any mental health issues? The first one that's probably the most common is depression. So the thing with depression is I think a lot of us think of depression as just feeling sad, but it's more than that. It's when you're feeling really sad for a very long period of time, not just for a day or so. And because of this, it can actually affect things physically for a person. Usually what I hear of when people have issues with depression, they have poor sleep, a lot of issues getting to sleep. At times they could be sleeping too much. And then the other thing I hear a lot is people saying that they have no desire to eat. So sometimes people can lose a tremendous amount of weight and nutrition because of that. Other things that could happen is having less energy, not liking the things that you usually like, your hobbies. And at the end of the day, the things that are helpful for this is therapy and sometimes a medication, which are known as antidepressants. Next, there's another disorder known as bipolar disorder. This is a little bit less common than depression, but it is very similar to it. So basically, I tell my patients that bipolar is really having that period of depression, but also if you have an added component, which is called mania or hypomania, this is where you have almost the opposite of depression. You have a period of time, a very distinct period of time, a couple of days or weeks, where the energy levels are so high, way more than normal. And usually because of that, the sleep is a lot less. Because you have so much more energy, people do a lot more things during that time, are a lot more productive. However, they could also have a lot more anger. They could be more distractible. They could be, where it can get dangerous is they can do risky behaviors like driving really fast or gambling and spending a lot and tons of money, sometimes going bankrupt, and sometimes having a higher sex drive as well. But the one thing to remember is this only happens for a few days or for a few weeks, and then patients usually talk about crashing. Everything ends and then they go into a deep depression where they're sleeping a lot more. So if there's anyone that you know that has these kind of issues, medications can be very helpful in treating it. I've listed a few there. But the one thing to know is that usually these people should avoid antidepressants because that can push them into mania and then cause more ups and downs at the end of the day. The next one I'll talk about is post-traumatic stress disorder, PTSD. This is something that I imagine a lot of people in Sri Lanka likely have, because as you all know, there was a very vicious civil war that happened. There was recently a very deadly terrorist attack that happened. So whenever there's these traumas, but it doesn't have to be something big like this. It could be, some physical abuse or sexual abuse, or even COVID-19, any traumas that happen. So what ends up happening is after the trauma, people may continue to have these memories of what happened, and it might be very distressing to them. A lot of people tell me about waking up in horrible nightmares, so much so that they're sweating. People tell me that their whole bed is soaked with their sweat, or that they might be punching their spouses in their sleep without realizing it. Obviously, people tend to avoid whatever reminds them of the trauma. And what ends up happening is they might actually forget what exactly happened. In a way, your brain is almost blocking out a lot of those memories itself. So unfortunately, this could really change a person's personality. They might become in a constant state of fear or of anger. Again, they may not have any interest in things. The one thing I noticed, which is really hard for the person, is a lot of people tell me they can't feel love the same way that they know that they should be able to. In a sense, they feel detached, even from their own children, even from their own loved ones. So it can cause a lot of issues in the family as well. The thing that is really helpful at the end of the day is therapy around trying to process that traumatic event, so that hopefully you can try to make some kind of understanding and peace with it. Though also medications can be helpful for sometimes specifically the nightmares, or antidepressants to help with some of those negative emotions. Anxiety and panic disorders. So I think anxiety is very common, especially right now with COVID. I think everybody is having a lot more worry than normal. So this is when you have excessive worry, and it's difficult to control it, to control those negative thoughts. So this, again, is associated with a lot of physical issues. You can have, again, poor sleep. You might be irritable. You might be tired, restless. And if it gets really bad, something known as a panic attack can happen. So a panic attack, a lot of people tell me that essentially they feel like they're having a heart attack when it happens, because their heart rate is going very fast. They're sweating a lot more. They might be feeling numb. They essentially feel like they're dying. A lot of people explain it as. And so a lot of them end up going to the emergency room and have a heart monitor, and are usually found to have no abnormalities. And that's a lot of ways how people can find out that they have actually an issue with anxiety and not a heart problem. Again, therapy and antidepressants can be very helpful to help with those anxiety and panic disorder. The next one I'll talk about is something known as ADHD, attention deficit hyperactivity disorder. That's essentially when a person has a hard time staying focused for long periods of time, because a lot of times people will tell me their minds are just going too fast all the time, with many thoughts going on at the same time. So because of that, they might make mistakes at work. They may not listen directly to a person. They might, in a sense, zone out. They might lose a lot of things. So if you or your friends are losing their keys often or their wallets, they very well might have ADHD. They just have a hard time following instructions and organizing tasks. A lot of them who have the hyperactivity tend to fidget a lot. So they might have a hard time sitting still for long periods of time. They may have a hard time sitting and watching a TV show or a movie at length. And they just feel like they're always driven by a motor. They're the ones who usually talk a lot, might answer a question before the other person has finished talking. And for that, there's some medications that can help as well, so that it's easier to focus, and people find that their anxiety is a lot less when they take medications. Next, I talk about substance use disorders. So this is basically when people have an issue with a substance. The one thing I want to really emphasize is that I think in our society, we've been told that addiction is a moral failure. It's a failure of the individual. What I'm here to say is that's not true. A lot of individuals are, as I say, self-medicating their mental health issues or even some physical issues as well. And so addiction is when you have a compulsive behavior, meaning that you continue to do something over despite negative consequences. And sometimes if a person has been taking a substance like alcohol for a long period of time and they stop, they might have what are known as withdrawals. And so there is a genetic component to this. The brain does change after a long period of time of using a substance. And a lot of people who have issues with substances have usually had a traumatic event or trauma in their life. Another thing I wanted to mention is that physical dependence, a lot of times in our society, people misuse the term addiction. And so physical dependence, which is when you take a medication, for example, I'm going to talk about opiates for people who have pain. If you take that consistently, but you take it as prescribed, you're not overtaking it, and then you stop, you have physical withdrawals from that. And so those people are physically dependent, but they're not addicted because, again, they're not taking more than what is prescribed. So to help with that, there are support groups, therapy, and there are medications that can help as well. And lastly, what I wanted to talk about, and essentially the alcohol use and also other substances. I heard that Winnipeg, pretty similarly to my current city of Bakersfield, has been having a lot of issues with methamphetamine and opiates, specifically fentanyl as well. And so these are definitely rising as well. Methamphetamine is a type of stimulant. And so stimulants make a person a lot more hyper, and they can make them go into what's known as psychosis, which I talk about next. Psychosis is not an illness, it is a symptom. And so it's actually a lot more common than a lot of people can realize. So psychosis is generally thought of as a disruption to a person's thought pattern. And it makes it hard for them to realize what is essentially real and what isn't. A lot of times people could be having, they might be seeing things that aren't there, or might be hearing things that are not there, like voices, or they might believe things or feeling like people are out to get them, people are following them, or they might have certain delusional thoughts as well. So this can happen in multiple disorders. I think for the most part, a lot of people think of psychosis happening with schizophrenia, but it can also happen with bipolar disorder, it can even happen with depression, or with using substances. There's many other reasons as well why psychosis can happen. The next slide that I put in here talks about the ripple effect of mental health. Again, we usually look in our society, we think of mental health, we think of the individual only, but we don't really think too much about the fact that the family members, who are also affected greatly, may have to take care of the individual, and then it also causes. It's a big cause for homelessness. There's about 37% of people who are incarcerated or in prison systems have a mental health disorder. And so, unfortunately, a lot of these issues in our society are related to mental health. And so by us really trying to focus on mental health, hopefully we can end not only issues of suicide, but also with reducing prison rates, reducing homelessness as well. I put this next slide in here because, again, a lot of us didn't really grow up with knowing much about mental health. And so because of that, I think it's pretty common for people who say, okay, I'm feeling a little sad. I think it's common for people to try to convince the other person saying, your life is good, your family is good, you have a house, if you smile more, that should help your mental health. maybe you're not trusting in God enough. So these are all the things that I can tell you do not help. In fact, it can actually make the person feel worse and feel like they're not being heard or listened to. So the best advice I have, or especially if someone comes to you and tells you that they're having issues with substances, is that you could, the best thing to do is simply ask them, how could I best help you? Tell me more about it. Just being curious and just being a shoulder to listen to. You don't have to give any advice unless you feel that, maybe seeing a therapist or getting a medication could be helpful. But sometimes all that's needed is just for the person to know that they're being heard and understood, and that they know that they're being loved and supported as well. So now I'm going to go into specifically the effects of COVID-19 and talking about the multiple different ways that I've seen it impact individuals. So unfortunately, it almost feels on a daily basis now. I'm luckily have the opportunity to see everyone through telepsychiatry, but unfortunately it feels like every day I'm either having a patient that has COVID-19 or has just today, actually right before I spoke to you all, one of my patients told me that their uncle just passed away from COVID-19 about 4 days ago. So this is really common here in the States. I know that in Canada, you've done a much better job in handling it. But my hope is that after I tell you more about this, that you just stay very diligent, very safe, take all the precautions you can. Because the one thing that even I didn't know about until I was looking at the data was that there is a direct impact of COVID on the brain itself. COVID is such a strange virus. It seems to affect almost every organ system in pretty horrendous ways. So it seems that people who are the most affected, the median age of people affected by COVID, again, on the brain itself, are the elderly people. They said about 71 years of age. Of those people who've had an issue, about 2/3 of those people had what are known as a cerebrovascular event, or for example, a stroke or a brain bleed. And then about 1/3 of those people had what was known as altered mental status, meaning that their thought process, it was not the same way as it was before. So of those people, about 1/4 of those individuals had brain inflammation or just a brain disease, whereas about 2/3 of individuals had psychiatric diagnoses. And what was really extraordinary to me was that 92% of those people were having new diagnoses, meaning they did not have any psychiatric diagnosis, but COVID caused psychiatric illness. And so about 40% of those people had a new onset psychosis. And if you remember, psychosis could mean hearing things, feeling like people are out to get you. About 25% had dementia-like syndrome, so forgetting things. And then 17, they say it was about an affective disorder. Affective, again, means depression, bipolar. So it can absolutely affect the brain in a multitude of ways. It was found that about 50% of the people who had the issues, maybe more of the psychiatric issues, were younger than 60 years. So in other words, about half and half could happen either way. Whereas if people were having more of those cerebrovascular events like strokes or brain bleeds, it was only 20% for people who are younger than 60. So a much higher likelihood for the elderly to have something like a stroke or brain bleed from COVID-19. And next, I'll talk about the indirect effect of COVID. So this really encapsulates a lot more than just the shutdown and being isolated, especially here in the States, because the politics are so partisan, I think is the best way of putting it. So partisan here. A lot of my patients are struggling desperately financially. A lot of them were laid off because of COVID-19. I have single mothers who basically tell me they only have $5 to their name and they can't get through to the unemployment office because the lines are totally packed. And so there are a lot of people really struggling out there, not just the isolation, but also financially as well. And not surprisingly, the data has shown that, yes, there are increased levels of almost everything because of COVID. There's been about 3 times more cases of anxiety compared to last year around the same time. About 4 times more symptoms when it comes to depression. And about 1 in 10 people said that they started to increase, substance use because of COVID-19 in a way to cope. Suicidal ideation. So suicidal ideation doesn't mean suicide, and ideation means that you have the thoughts of suicide. So people reported that thoughts of suicide also increased by 2 times compared to 2018. And it was reported in China that COVID-19 survivors, a huge amount, almost 100% of people said that, yes, they had post-traumatic stress disorder, the experiencing the trauma. They had symptoms of PTSD. So in the next slide, I found this really nice graph really showing how exactly this happens. And so as it shows, it's not just this isolation or the economic problems, it's just simply the uncertainty. We don't know what's going to happen. We don't know how long we have to be on lockdowns. People don't know what's going to be happening with sending their kids to school. There's always uncertainty. If you go out, you're at a higher risk. And so it just shows how all these could affect vulnerable individuals, and essentially through those issues of depression, anxiety, alcohol, that can lead people to suicide. So the people who are at the highest risk of experiencing these issues are actually young adults, Hispanic and Black individuals. I assume in Canada, Aboriginal people would be more affected in a similar light to the United States. Essential workers, unpaid caregivers for adults, which I'll talk about in a little bit more, and those who are already having and getting treatment for pre-existing psychiatric conditions could be affected. And so they really talked about, they made a point in the papers to talk about how much the unpaid caretakers are really experiencing a lot of mental health issues. And I can definitely tell this as well from a lot of my patients. There's some who are really, really, really struggling because, for example, they had a family member that was diagnosed with cancer before COVID, and getting chemotherapy. And as you can imagine, once COVID hit, you have another huge liability, another huge danger, not only for the mother, but also for now the whole family, who has to be much more isolated, much more careful with the stress of perhaps bringing it back home and being the cause of the death of a family member. So they, especially those, are at very higher risk for those with COVID-19. So the question is, what do we do about it? How could we really help our society? What can we do as individuals to really combat suicide or mental health, just in general, during COVID-19? So they had some really good suggestions, which I wanted to talk about. The main thing is we do need a very universal approach in how we're going to come and really implement a lot of these things as well. So this involves these kind of presentations as well, which I think is why it's so important that you're even having these presentations to allow for the community to not only learn, but to support each other. It is so important what you're doing here, and I really can't tell you how impressed I am that you guys are doing it. But really what we need to figure out is, how do we reduce the stress? How do we reduce the fears and the loneliness in our general population during these really tough times? So really, they talk about social media campaigns that are supposed to promote mental health, reduce stress. One of the main things that I really try to emphasize is getting back to the very basics of what makes us human beings. And that is sleeping well, that is eating well, exercising, meditation, maintaining friendships, whether it be on the phone or through video chat. Making sure that you identify those in your community that are living alone, for example, or have very few contacts, and making sure that family members or friends are checking in with those individuals. Just even doing more screenings, this would be a little bit more on the medical side, but maybe it's even something that can be brought upon in the community itself, and just check-ins, seeing how everyone is doing with their mental health, if they're having any issues with feeling depressed or feeling anxious, or even having suicidal thoughts. The more that we can talk about this in the open, the biggest issue, the biggest thing holding all of us back when it comes to mental health isn't even really education. What I would say it's our ability to talk with each other about our mental health and to admit that we even have these kind of negative emotions. That's going to be the biggest challenge, or the biggest project for all of us to do, because we were never taught really how to do that in our society. But the more we can do that, the more lives that you can absolutely save by allowing for those emotions to be discussed. And another thing that would be great is if the media did a lot more responsible, a lot more timely reporting on everything that's happening. Personally, I barely heard any news about the mental health effects of this COVID pandemic. But what I do know is that, yes, suicides and overdoses are all skyrocketing because of the COVID-19. It's good for organizations such as first responders, caregivers, clergy, to be able to identify those who are at risk in the community. There are always what are known as suicide prevention helplines. So if anyone does have any suicidal thoughts, you can always call anonymously. I'm sure in Canada there's a hotline that you can call or even text if you're ever feeling that way, and you can talk anonymously with someone who, just so that you have someone to talk to about what is going on. If you do need to get any mental health care, you don't necessarily have to see a psychiatrist. You could go see your primary care physician, and a lot of them might even be able to prescribe either medications or refer you to a therapist so that you can start to feel a little bit better in that way. And obviously, for me, I'm also very politically engaged. It would be nice, again, to see the American government do what the Canadian government did when it came to giving aid and assistance to the people. And unfortunately, I can see the big disparity of what's happening when the government doesn't really take care of their citizens that well. So for people who have increased risk of suicide, the subgroups, the people that are even more higher risk, these are people, like I said, who have psychiatric disorders, people who are survivors of COVID. And another thing that isn't really talked about too much is just how much the frontline healthcare professionals are really getting beaten, if I'm being honest. A lot of my friends are telling me about the burnout that they're feeling from the increased workload, or from just hearing what's happening and seeing what's happening to their patients. A lot of people don't know, but the highest, the profession that has the absolute highest risk or the highest rate, I should say, of suicide are physicians, are doctors, even more than the military, even more than dentists. So it is important to be able to take care of the healthcare professionals as well. So if you do want to get treatment, but you are worried about going in person, going out in public, and getting COVID, telemedicine is always an option. So I would definitely talk with your healthcare provider to see if that would be an option for you to do. And it's, I think, important for everyone to be able to limit the news that they're watching, and try to make sure that they're not getting too anxious or depressed from watching the TV screen. Because again, a lot of times the news will always be showing the negative as opposed to positives that are going on. So that could easily affect a person's mental health negatively. All right, so that is all the information I had for you all today. Thank you so much. And is there any questions that you all have for me?
I don't have a question, Iru. I just wanted to make a comment that, it was very informative knowledgeable presentation, I felt, and I'm very thankful that you have done that. And thank you so much.
Oh, thank you so much for saying that.
I have a question.
Yes.
Hello?
Yes,
Yeah.
can you hear me?
My question is, can somebody who is very, what you call, intelligent, also have ADHD?
Yes. In fact, I would say yes, absolutely. In fact, I would say that I would even say that perhaps some of the most successful people very likely have ADHD. And so once, because the thing is this, so a lot of people with ADHD, if they have a specific focus, a specific passion that they have, that is something that can really, they can become excellent in those fields. So you'll see a lot of artists, you'll see, I bet you, a lot of politicians. ADHD is a lot more common than what people like to talk about. But yes, absolutely. Some of the most, I know some very intelligent individuals, very smart, who have ADHD as well. So yeah, absolutely. And I want to say that intelligence can be with any of these disorders as well. Mental health disorders don't have much of an effect on intelligence. The place that it has an effect is when it comes down to things like concentrating, focusing for long periods of time. That's where the issue can come in.
Okay, thank you.
No problem.
I want to know what is nervous breakdown means.
Nervous breakdown would be similar to that anxiety or panic attack that I was talking about before. So nervousness, so usually I think probably a nervous breakdown is similar to that panic attack. So the panic attack is when, again, you feel like you actually feel like you're having a heart attack. But the one thing I've also noticed is that, again, we with our own terminology, I think perhaps in our culture, we didn't have that type of verbiage or that type of ways of describing these things in a better fashion. So I wouldn't be surprised if people who even had, depression, for example, and because depression can be very debilitating. A lot of people could just stay in bed and not want to do anything. And so I wouldn't be surprised if some people also labeled that as a nervous breakdown as well. But the two are different in the sense that depression is much more, you have very little energy, don't want to do anything. Anxiety is a lot more of an active, I feel like I'm dying type thing. So either of those could be kind of considered as a nervous breakdown, I think.
Thank you very much.
I have a question on the survey that you had been doing. According to your knowledge, do you think certain ethnic groups will be less to have mental issues? Like, for example, we know that diabetes is more rampant in the Asian community than in the white community. So similarly, would mental illness be more in a certain community or ethnic group rather than another ethnic group?
Yeah, that's a really good question. And so there's unfortunately a lot of ambiguity when it comes to figuring out that question. And unfortunately, so if I'll back up a little bit, if we were to look at diabetes, for example, with diabetes, that's something that is not stigmatized. People will go to their doctors and they actually have a blood test that can tell you if you have diabetes or not, right? And so it's very easy to make that diagnosis. Unfortunately, because of the stigma that we have in our communities, a lot of people don't go to get help in many countries, right? And so because of that, we don't know, right, if people actually are having all these mental health issues and just not seeking help, or if they are actually not having as much. The one thing, so from what I can tell, it is pretty widespread. I think that every ethnic group is having a higher likelihood or having a likelihood of mental health issues. One thing that is really interesting is that they looked at specifically those who have issues with psychosis. and they looked at the different countries and seeing how people fared. And what was really interesting is that in societies, and I think there was like some African countries and maybe even Indian, where they did not stigmatize or, you know, the issue with, you know, being in our society and having something like schizophrenia is that it's very isolating. A lot of people will stop contacting, and they lose their community. So obviously that individual is gonna not do as well. But in the other communities, it was almost seen as a gift. And I know in other timepieces, that was definitely a thing. These individuals would be considered to be special. And so they were given a place in the society and not put away and not isolated. And so those people did a lot better in terms of their mental health issues. Because again, they're not thinking that there's anything wrong with them. They're actually accepted for who they are and loved by their community. And so I think even more than who actually has, because when you look at mental health, everything has a genetic component, but it's also environment that is usually the cause of causing more stress, causing more depression. Usually these come because of issues in our society as well. So the way I see it, the more that a society is able to discuss these mental health issues and have policies, you know, ingrained in their society that allows for less stress and less depression to occur. And I alluded to it with even the two differences in the way that United States and Canada were very similar in terms of the demographics. Seeing how big of a difference there are in mental health outcomes because of simply the way that the government is helping them with different paychecks and stuff like that. So the long and short of it is that it's really tough to tell because there's so many different factors that go on to causing a person to have issues with their mental health.
I have a question for you. There seems to be more people coming for medication now related to stress. So do you have anything to say about mental health and medication and the relationship? Because I do a lot of volunteer work, and I have noticed that many people, I do the Buddhist meditation, but that they are coming for stress-related things to our meditation classes.
Yes, very good point. Yeah, meditation, I briefly talked about it, but I didn't talk too much about it. But yeah, meditation is extremely effective, very helpful. It's just good for everybody, in my opinion, to at least practice what's known as mindfulness, which is a type of meditation.
That is exactly what we are doing. We do mindfulness meditation. So that's the one that we have.
Yeah, because it's actually been shown with data, I think with brain scans, that yes, it absolutely does help. You know, staying in the present is a big, can not only help for, I think, you know, depression or anxiety, just overall mental well-being, appreciating the things around you. Yes, very, very important, something that can be helpful for everybody.
Well, I have a question. Among the suicidal cases in Canada, they say the majority is native people, Aboriginal people. So is there any reason for that?
So yeah, there is, and this is a much this is a little bit harder of a explanation to give, but it's something that so the way I see the issues, and as you can tell, there's a lot of issues even politically within the Aboriginal community in Canada, and it's very similar to the issues of Black people here in the United States. So my belief is that they're pretty similar reasons. But if we're looking all the way back into the history of you know, when white people came or Europeans came into Canada, or United States, and what happened with the other ethnic groups, there was a lot of trauma that ended up happening to Aboriginal people or to Black people. They were, there's been cases where, you know, kids were taken away from families, and they were tried to give what's known as re-education. And so, unfortunately, they had a very different way of living life, right? It wasn't based on the kind of system that we have here, which is very, very, very different. And so if you were to think about anyone just coming and just changing everything, and at the same time not really giving you much opportunities to succeed, or even if they do, it's very hard when you have so much trauma in the background. And the problem is it kind of continues generation to generation. So if you have parents that weren't educated because simply education wasn't part of their society and community before, then when they have kids, and if there's trauma, whether it be physical or sexual abuse, those individuals are going to be a lot less likely to succeed in life because they don't have education. And only that, and they're more likely to go towards alcohol or drugs in a way to try to cope with the traumas that they have. And so because of that, it's a vicious cycle, and that just continues down generation to generation. And that's why it's so hard for both the American and Canadian societies to figure out what to do with these kind of issues, because unfortunately it's going to continue until we find a way to either give them back their way of living, or to allow them a better way to integrate into our society. But that's going to take even more mental health services specifically for those subgroups of individuals like Aboriginals or African Americans in North America.
Thank you.
The very beginning, Charlotte mentioned about the questioning time. Anyone can ask single questions as well. ඕන කෙනෙක් ඉන්නවා නම් සිංහලෙන් ප්‍රශ්න අහන්න පුළුවන්. ඒක ඉරු ලැහැත්ති කරලා තියෙන සිංහල ප්‍රශ්නට උත්තර දෙන්න. අහන්න.
ප්‍රබෝධ්‍යව වැඩට දාන්න මම question එකක් සිංහලෙන්ම අහන්නම් ප්‍රශ්න.
Okay.
ඉරු දැන් ඉරු ඉස්සලා මේ කිව්වා නේද මේ medical profession එක තමයි වැඩියෙන්ම මේ suicide rate එකක් තියෙන්නේ කියලා. ඇයි එහෙම ඇයි medical profession එකට doctors ලට වැඩිම මේ suicide rate එකක් තියෙන්න හේතුව?
He's asking why medical profession has more suicidal rate than other professions, which you already understood probably.
Good.
I like it. I like that translation. It's really interesting. If you think about it, it makes no sense. The very people that are medical professionals, we should know the best, right? When it comes to taking care of our health, our mental health, why are we the ones that are the highest rate? So it's interesting. There is a lot, and I can definitely agree to this, is that there's a lot of fear for doctors or medical professionals to get help. There's always these worries that what if the medical board finds out? What if I lose my license? What if there's just, again, a lot of stigma and this belief that, well, I'm supposed to be a person who can take care of everyone else. What does that say about me if I have to go and get help as well? Which, you know, the more that we talk about it, doesn't make much sense. But I can't emphasize how much stigma really stops people from getting help, and why stigma, I would say, is really the biggest cause of suicide. Any of these issues can be solved if we were able to have a better dialogue. We can be open with each other about these things. People had access to get the help they need, which again is another issue as well. Do people have even the access to get the help that they need? And so I think the biggest issue that they found with why doctors are the highest risk is stigma. Yeah, just not getting the help when they need it.
Thank you, Iru. I have, if Senaka, if you allow me, I have another question.
Go ahead.
More related to Sri Lanka. Now, anyone can correct me if I'm wrong, but to the best of my knowledge, we haven't heard much of mental sickness being spoken in our society in Sri Lanka. Is that because we are afraid of the stigmatization, or is it more the tropical nature itself removes the mental ability, the sicknesses that temperate countries may have? So I'm not exactly sure, but I thought a professional like you, Iru, might be able to answer that.
Yeah, no, it's you would imagine that you know, environment has a big impact. on mental health or even community. I think even more than the temperature or the climate, just being part of a community, which a lot of people here in North America don't have. It's much more individualistic, much more isolating. So I think when they even look at different subgroups, the white people are at higher risk are the highest risk of suicide compared to all other ethnic groups, at least here in the United States. So I think community has a big aspect of it, but no, it's absolutely a stigma thing as well going on, either in Sri Lanka, India. And the reason I know this is when I went to India and Sri Lanka recently, I asked a lot of people about it. And I think my cousin was telling me, yeah, there's the mental health services are very much lacking. And there's a huge stigma about going and seeing someone for these kind of things. And again, it comes from the fact that, is like you said, how many people talk about it? You know, no one talks about the fact that they might have issues with depression or anxiety. But there's absolutely suicide rates happening in Sri Lanka as well. I think I remember that a couple people had died by suicide right after a cricket match. I think after Sri Lanka had lost a World Cup or something like that. And so obviously those people, it wasn't because they lost a cricket match, but it was because they most likely had pre-existing depression or anxiety, and that was just what set them off over the edge, if you will. So I think that our countries are better in terms of having less of the mental health issues because of the community aspect, but we absolutely, there's a lot of people suffering out there for sure, and not talking about it because of their fears of what would happen if they brought it up in our community.
Thank you, Iru. Just another follow-up from one of the slides that you had, that people should be talking to each other, sharing things with each other that would comfort within a community. I think Sri Lankans have done pretty well during the COVID situation, at least sharing things that are fairly interesting, even to the extent of being comic, that you will see that they are sharing on WhatsApp or whatever social media. The amount of humor that they bring, I think, has really at least helped me while during the main shutdown in March and April, especially when it was also cold here. It was very helpful. And I think Sri Lankans are in one way blessed with that kind of humor. They can make humor out of any situation, and even during the elections we saw that. So I think you are right in that. I think sharing things, sharing ideas is a great opportunity to relieve that mental stress that we might otherwise go into.
Mm-hmm. Yeah, exactly right. Whether it be through WhatsApp, I mean, honestly, the one thing that I'm so grateful for is I was thinking about this a lot, because I mean, even the fact that we're doing it this way, how amazing is technology? I mean, even look at, I think like 20 years ago, we had to use a dial-up and people couldn't even use a phone while we were on the internet. Now look how far we are, right? So the one thing is we really should take as much advantage of technology as we can, because it is the perfect medium for us to continue to stay connected with each other, while we have to continue the isolation for who knows how long that's going to be, right?
Hello, Iru, excuse me, can I ask a question? Can you hear me?
Yes, I can.
I just want to know, is there a connection between a full moon day and these psychiatric patients, those who are suffering from psychiatric problems? Is there a connection?
So, so I remember actually hearing originally that there was some data to say that, yes, it looked like there was more emergency room visits around the time of the full moon. But then when I looked a little bit deeper in the data, luckily I actually brought that up with someone else, and they said, I don't think that's true. And then so I looked a little bit more, and then the data showed that no, that's not actually true. So at least with what the data shows, which I'm sure isn't really extensive by any means, apparently not. But I'm sure there's a lot of people who would say that there are.
Okay. Thank you, Iru. Thank you.
Iru, can I ask another question?
Sure.
Yeah. Now, based on, I mean, what members had asked, now, and also when Dilantha mentioned about our Sri Lankan group, now, if we suspect that somebody is sort of having a mental problem, say in our community, now, or even in any other community, how do we approach that person? I mean, it's a very tricky one because you don't want to go and, you know, because they will feel uncomfortable, you know, because of the stigma. So
Yeah.
what is your best advice on how to approach somebody if we feel that they are suffering from mental illness?
Yeah, that's a really great question. I'm happy you asked that, because that is probably the $1 million question, the one that will be the most common for all of us. And so I think the first and foremost is if it depends on the situation, and it depends on your relationships with those people. But if you, for example, if it's a friend, and you feel like something is off, sometimes talking to the family members to see how they feel, if they feel like there are any issues, could be helpful. But if the main thing is if you can find a way to simply bring up, it's a really tough question, because obviously it depends on your friendship with the person. Ideally, you should be able to simply say, hey, these are really tough times. I've noticed that you seem a little distant, or maybe you just don't seem like yourself. It's really common for people to get more down and anxious. You can even say, hey, I heard this presentation where it's skyrocketing right now. Try to make it normalized. The more normalized that they feel, and the less that they feel that they're going to be judged, that is the key. If you can make sure that you can talk about these things without the judgment, and just simply be there for the person, as long as that person feels comfortable with you, then that is where you can get that person to even talk to you about it. And even maybe by simply talking, because a lot of people keep all these emotions inside them, and then they start to think, oh, there's something wrong with me. And then it's again a vicious cycle. The negative feelings start getting worse and worse. So the more that you can just talk about it in a very normal fashion, in a non-judgmental fashion, that would be the best way to bring it up with them. But yeah, if that doesn't work, then I think at that point would be good to talk with family members or other friends to just see how it's going. And if there's any serious, even still, it might be good to try a few times to see if that person is, or just keep in some contact, just keep it nice and light in terms of the contact you have with them, even reaching out, saying, I love you, I hope you're doing well. Those kind of things can go a really long way.
Okay, thanks.
No problem.
One other question that I had was, in your presentation, you didn't particularly mention, or I might have missed it, with the COVID, people are working from home, and that amounts to a certain amount of stress. Mainly if you have kids, you have to take care of the kids' needs on a constant basis. You are also helping their schooling. And then also on top of everything, there are more meetings now than any other time, and you're working sometimes more than 8 hours. So, so I'm wondering whether you have had patients coming to you with those kind of concerns and stresses, or what your thoughts are on that, and how to cope with it.
Yeah, absolutely. I mean, everyone, and I have a lot of people who are educators who are really stressed right now because of just how uncertain everything is on their end in terms of, they don't even know schools are going to be reopened, if they have to go in, they have to learn all this new technology to be able to teach the kids. So yeah, tons of more stress. The one thing I try to tell people is, just because I think a lot of people take, especially those with a very strong work ethic, take in a lot of that additional stress if they're, it's taking longer for things to get done, or it's taking longer for meetings to happen, for example. What I try to tell them is, just remember that everybody is going through and struggling right now. And my hope is that workplaces, coworkers, everybody can give each other a break. You know, we're in such bizarre, stressful times that I think it's normal for things to be taking a little bit longer, for you know, just for more, maybe even mistakes and stuff like that to happen. So I always say, like, try to take some breaks. The nice thing is that you're home as well, right? So in the comfort of your own home, hopefully, even if you find that you're getting too stressed, take a break, you know, go and maybe even watch a little TV to get your mind off of it, meditate, exercise, or just spend time with the family, even for a little bit. Just remember that the reason why you're at home is for your loved ones and for yourself. And the more that you can remind yourself of that and remember that you don't have to be perfect. Well, just in general, you don't have to be perfect, but especially during these times with all the changes, totally fine to be making mistakes and taking longer. That usually helps a lot of people put it in perspective that they don't need to be taking it seriously as they usually do.
Thank you.
No problem. All right, so I think with that, I do need to see some patients right now, but thank you so much for this opportunity. I hope it was helpful, and yeah, I look forward to that video. And if you can all try to, I'm not sure if everyone got that survey, but if you don't mind sending it to all the members again, because my hope is eventually to look at all that data that you all put in there and try to make a more comprehensive video so that I could really try to educate people, like kind of like this way, but on a larger scale, on how South Asians specifically can tackle the mental health issues that we have.
Iru, thank you very much. We have taken more than 1 hour of yours. So I will
I have a final question. Might sound
sorry.
It might sound funny, something personal, and when I'm home and Auntie Srima tells me, "Bakamunawagi innos kata karanneවත් නැහැ කියලා." දෙක දාගත්තම නම් හොඳට කතා කරනවායි කියලා කියනවා. So is that alcohol helps my brain to work a little bit?
For sure.
I think we'll all agree on that, Peter. You're not alone.
So I'm not alone, right?
You're not alone, and Srima is telling you the truth, damn truth.
Oh.
Very much, Iru. We have taken more than 1 hour of yours.
Oh, so yeah, no problem. Thank you so much, guys. Be safe.
Thank you. Thank you. Well done.
Thank you very much. And at the same time, I want to thank Dilanta also. From the very beginning, Iru had given this appointment for us. Dilanta was after us, and he gave all the information. Thank you, Dilanta.
Oh, you are very welcome. It was a good thing that Iru could join us and do this and help us. Yeah, thank you, Iru.
And at the same time, I want to convey my thanks to Prabodhya, who helped us to do in Sinhala also. Prabodhya, thank you very much. Bomi stuti Prabodhya appearing out.
Okay, thank you. I didn't feel like I helped much, but I enjoyed listening to Iru. I enjoyed listening to Iru.
Thank you.
Thank you.
At least we saw you.
That's good.
And at the same time, I would like to thank all of our members to participate today with us, with Iru and our members. Thank you very much, all of you.